Hello, I'm Dr. Babita and I am a practicing dentist here in Australia. I would like to tell today few rules which we need to follow in dentistry to make life easy. And as a beginner dentist, we get overwhelmed with many things, but I would like to simplify this and make you understand. First thing, I think for any dentist, when we're practicing dentistry, communication is very important. So we need to communicate things clearly to the patients, and I think when we are being authentic, that communication actually gets better. It's not that we know English or we don't know English, and especially we being not a native English speakers, it actually doesn't make any difference. And if we are authentic and we genuinely want to help patients, it will show in our communication. So try to make things easy for the dentist. And I always think, if I have to tell this to my mom, how will I make things understand to her easily? So tell things in simple ways. So in that way, patient will understand you and accept the treatment plan. I will talk about communication in another video more detailedly. And the second thing I would suggest you is follow ethical dentistry. Ethical dentistry is very important in a long term. So we are dentists, we chose dentistry, and we are going to be dentists for a very long time, and we can't run away by doing non-ethical dentistry. So I would suggest you follow ethical dentistry and don't overtreat patients. And just I always think in my head, if it was my mom or dad, would I advise this treatment to them? So when we follow these ethics, we can run long term. And the other thing is, give options to patients. So sometimes we go learn some new technique, and we are very excited to do that. And sometimes we think uh, giving bigger treatment plans will make money, but I all so people so it's always better to give options to patients. So if maybe one or two options, or sometimes three options. For example, if it has a big decay, you can clearly tell the patient, see, you have a very big decay, it is very close to the nerve, and it might need root canal treatment. Or the other option is extraction and an implant, or extraction and just leave it. When you give options to the patients, they will choose what is convenient for them. Sometimes there can be money issues, budget issues for them, and they might not value their teeth as much as you value them. And because of that, um, if you try to tell one thing more, like go for a root canal or go for an implant, they might assume that you are selling dentistry. So ethically, we need to give options to the patients and tell the pros and cons of each thing, and according to their situation, according to their budget, they will choose the treatment plan. So I always felt giving options gets back the patient. Even if not now, they will come back later on for whatever is right for them. So give options to patients. So communicate clearly to them in simple words, and do ethical dentistry. Give options to patients, and try to the other important point is, the fourth point is, try to comfort the patient. So we get a lot of anxious patients in dentistry. So if we are little bit empathy, if we show empathy to them, they actually stay with us. Anxious patients are actually good patients for dentistry, for dentists. So if you're empathetic, if you're caring, they can be really loyal patients for a long term. So I follow few small techniques. We can talk about this later, but giving control to them whenever they're on dental chair, you can tell them, raise your hand, um, I will stop the procedure. And in that way, they will feel they are in control of you. And also putting that numbing gel before giving the needle is another important thing where the pain levels go down, and proper anesthesia is very important. Sometimes we think this is a small procedure, let's just do it without anesthesia, but even sometimes a small filling or even scaling, if they feel extremely sensitive, it is better to anesthetize them properly so that their anxiety gets in control, and they are comfortable in your practice. So uh, try to calm the patient, calming environments, maybe noise cancelling headphones, giving numbing gel, going slow and giving slow anesthesia, putting that numbing gel beforehand, early morning appointments, and asking them, are you okay in between the procedures? All this actually calms the patient down, builds trust on you, and these patients are very loyal patients who are anxious patients. So and another thing I would suggest you is learn learn your skills, learn basic dentistry well. So as a newcomer, we always want to do everything. We want to do aligners, we want to do implants, we want to do full mouth FMRs. Even I always felt I wanted to do everything, but I was advised, and with my experience, I also understand if you have to learn the basic skills perfectly first, like do good fillings, do good class 2 restorations, tight contacts, no good isolation, and learn proper extractions, learn proper endo. These are prosto skills. So learn one after one. For example, endo, choose your anterior teeth first and then go posteriorly. Don't overwhelm yourself by starting a posterior molar tooth without doing enough anterior teeth. And also extractions, do some extractions which are simple and then go to surgical extractions. Surgical extractions also, don't jump away, straight jump away into wisdom teeth extractions. I think you should do some premolars and anteriors surgically when they're broken. Try to understand how you remove the tooth surgically, little bit of buccal guttering for few teeth, and then molars, and then wisdom teeth. So don't overwhelm yourself in the starting of your career. So basic dentistry first, do good crowns, single crowns, two crowns, maybe quadrant dentistry, and then shift to full mouth restoration. So don't overwhelm yourself, break the big task into small tasks, and then go step by step. Just, I always think, how is it taught in the college? How is it taught? They teach you simple things and then they teach you complex things. So go slowly, don't overwhelm yourself, and then as you learn good basic skills, you can confidently do the bigger things. So that's one another important thing I would suggest you. And sometimes you also have to upskill. Another point, important point, is upskill your dentistry. Find what is interesting to you, what you're passionate about, and upskill your dentistry. If you don't upskill yourself, if you don't challenge yourself, doing day to day, every day, same thing, it can cause you boredom, and boredom is nothing but burnout. You don't enjoy it anymore. So I always suggest we have to upskill ourselves and challenge ourselves. When we challenge ourselves, we find things interesting, and our we do more things, and it is always good. But I have personally felt that when I also think you should not challenge yourself too much, and you have to have that right balance, doing basic things and then challenging yourself and finding that right mentor who can guide you when you start doing things. And you should always have somebody backup to help you if you things go wrong. So you upskill yourself, get a good mentor, and take things, challenging things. And as you, and I also think sometimes we have to tell the patients, okay, this is the procedure I learned, and this is the procedure I learned, and you can maybe do it for pro bono, like just take the lab charges and do it on a patient who can't afford it. In that way, you also learn the treatment, and patient already trusts you. It can be your old patient who trusts you, uh, and then you can learn the procedure on them. And another important thing is, but when you're doing this, try to not keep running for the new things, and sometimes we run on so many new things and we don't enjoy the present. So you enjoy the present dentistry, what you're doing, and slowly introduce one by one and learn things. And going to courses is so important. You meet different people, you learn how they think and how they plan the treatments, and in that way you can network with people and understand what is lacking and what you can get better. And sometimes we might not afford all the big treatments, and in those, like those times, youtube teaches us. So YouTube University has so many things. You can download articles, you can see in YouTube, Instagram, and learn it yourself too, but you should put that time to learn. And when you're young, you should do it, maybe. Also, and another important thing I would suggest you is, don't shy away to tell I don't know something. So we all are in dentistry is a practice, so you need to practice enough times to gain skill in something. So unless you do it, you don't get skill. So don't get scared to try new things. But I also suggest you, if you're not interested in something, just don't. If you're not interested, don't do it. Would you go and get a brain surgery done by by a doctor who is not interested in brain surgery? Definitely no. So if you're not interested in something, you can choose to refer it to somebody else. There is no shame in referring. This is you don't enjoy everything. So when you're not interested, you can always refer. And when you enjoy something, I would suggest you deep dive into it, learn that skill so good that nobody can replace you in that part of dentistry. And another important thing I would suggest you is, you should always stay in a supportive environment where people are around you or supporting you, and not putting you down, or not making you try new things. So, for example, a flower, if it doesn't bloom, whom will we blame? Will we blame the flower? We will blame the nurturing soil. We will nurture the soil, and automatically the flower will bloom. So I would suggest you stay in a supporting environment. See that clinic where you're working, or the nurses or the team are supporting you. If something is not supportive, you get rid of them, or at least go to a better environment where it is supportive, where you can grow yourself. Staying too long in a non supportive environment can waste your years. I'm telling you with this personal experience, if you don't enjoy something, stop doing it. If you don't have a supportive environment, don't work in that place. So that's another important thing. And another important thing I would suggest you is, you have to be in a place where there is technology which is up to the market standards. You now dentistry is like so fast, and there are so many new things, and you should be in a place where uh, it is all present, and your principal values it, and the owner of the clinic invests in buying those things. Or you can, at least if you are the owner, you have to purchase and be in the market where you are using the best technology. And another thing is, I would suggest you, last but one thing, is don't compare yourself with others. In this in this Instagram world, and in this Facebook world, there are like so many photos, and people portray their best dentistry into the profiles. So remember that everybody has a journey, and you may be a bit behind in that journey, or so don't compare with them. Compare yourself with your yesterday. So how far you have come. And I would also suggest you, don't think that whatever is posted is true. Most of them is edited, most of them only the best pictures are put. So get motivated seeing it, but then don't compare yourself and get depressed. And we dentists have this we want to be perfect, and sometimes that can cause a spiral loop, and you might get depressed.